Hello friends, DrPoonamsvlog here from Indian Medical Association, Goa, Bardez branch. Today's video I would be talking to you something regarding the oxygen concentrators, how to use them, when to use them, how to take care of them, okay, all those practical points what you would need if you have to use an oxygen concentrator. Indian Medical Association, Goa, the Bardez branch in association with GENO Foundation has started an oxygen concentrator bank in which we have around 27 oxygen concentrators of different capacity, that is 5 liters, 7 liters and 10 liters, okay, which we are helping out to those people who are having problem and they require oxygen, okay, which can be given through oxygen concentrator. So we are helping them take this oxygen concentrator at certain there will be some terms and conditions which you have to follow. Following that, you get it for your use till the time you need it and you return it back to us. Okay, so let's go see what is oxygen concentrator and how we use it. This is how a oxygen concentrator looks. So overall, if you see it from close, there are various parts of it which are also kept here. So this is the main body of the oxygen concentrator. Okay, now to this body we have different parts. Now one of these, this is the humidifier, the place in which the water remains so that it humidifies the oxygen. Now this is the water level. Can you see this water? Now this is the highest level, so do not put water above this. That is number one. Number two, this is the main panel wherein the switch on and off will go on. This is the oxygen outlet from where you will actually get the oxygen. This is the oxygen level that your doctor is going to prescribe to you and you will take it accordingly. Starts from 0 to 7 liters, so you can continue till there. Okay, and these are the different parts which are there along with the oxygen concentrator. So I am basically trying to tell you about the oxygen concentrators which we are providing so that it is easy for you to use it. Okay, so first part is, as I said, the body. The second part is this cord. Now this cord goes behind the machine and it will attach the machine to the main plug, which is the simple this 5 amp plug. Okay, so now let's attach it to the mains behind. So just turn this machine. Okay, let's turn this machine. We go behind here. Can you see these points? Yeah, now put this jack inside. Okay, now let's hold it. Yes, it's gone in. Okay, so this is gone in. Now the other end of it, that is this part, goes in the supply and you put on. Okay, now once you put it on, there is another button here which you have to put on. Okay, once it is on this screen you will see there is a on and off that lights. Earlier it was not lighting, so now you just press it and all this comes. Can you see this? Wow, such a cute blue color, right? Yeah. So now this is the screen that will show the total time that it is being used in hours, the oxygen, how much it is going, okay, and that it is working, the fans are working. Can you hear that sound? Fuss, yeah? Yes, so that means it is working. Now once you are done with this, let it work for at least, when you use it for the first time, let it work for at least 10-15 minutes and then you start using it. Otherwise, there will be some smell, like plastic smell, that you are going to get. So now once you are done with this, suppose 10 to 15 minutes are over, now what you are going to do? Now it is almost settling. Now once you are done with this, what you are going to do next? Next is this part. Okay, these are the cords that you are going to use. The cord has a trap. This is the trap in the middle. Okay, so what you do is one end of the cord, that is this end, any end of the cord, goes in the oxygen inlet. Okay, let's put it in the inlet now. Yes, now this is gone in the inlet. This is the trap. Now what is the use of the trap? In case the water level here is too much, it's going to get entrapped here, so you can just open it. Okay, open it and you can remove that extra water which is there. Okay, it can be easily removed like this. Okay, with a little bit of here there is an arrow. You put that arrow and then just move it this way. Okay, yes, so if there is water, you can just remove that water and use it. Use the oxygen, that is the extra water, and in case there is extra water there, that means you have put too much of water in this tank, and remove that water. Now this is the other side of the tube, so you can see the tube is moving from there till here, and this is the other side of the tube. The tube. Now this tube can be attached either to this, which is a nasal prong. Okay, so this can be attached here, and then the nasal prong has to be put in your nose, which I will show you after some time. Or this is the head gear that you see. Okay, the head gear that it will go on your head, like how we use the, to hear the music, like that. And this part will be turned towards your nose, so that it sits near your nose. So those both the things I will show you now. So now you can see that the machine is running. We have attached the cord, you have started the machine. Okay, the cord, the other side. Now I'll tell you the two ways that you can use. So this is your head gear. It's exactly like how we use to hear the music. So this goes inside this. Okay, here it goes in, and then you put it this way on your head. Okay, and then this. Okay, there is a hole here which I will show you. For this gear, for this part, there is a hole here. Can you see that hole? It's here. This is the hole. Okay, so you put that head gear like this, and then the hole this near your nose. You'll get a blast of air. All the oxygen coming in here. Okay, so yes, so hold it somewhere close to your nose and breathe in deeply. So you may breathe in when you are sleeping, when you are watching TV, or when you are sitting quietly, when you are sleeping, sitting, whenever. Okay, so this is one way. The other way is remove this cord. You take the nasal prongs, attach it here like this. Now these are the nasal prongs. Can you see this? Yeah. Now these two things will go inside your nose. So you put it like this behind your ear. Okay, this is your ear. Now this is your ear, and these two things will go inside your nose, and then from backside. Now I will not put it inside because this may need to be used by some patient. Okay, so I'll just keep it outside. This rubber band here, you are going to pull it. I will keep it on my nose here. Okay, so you are going to pull it till it fits tight. So you can imagine this will go like this inside your nose, and this remains snugly fitted here. So this will go inside your nose, and this will fit in over there. Okay, I hope you understood that. So that is about how to use it. Now let's come to the maintenance of the device. So let me put it off now. Now here I am putting it off. This is off. Okay, now maintenance device is this tank which you can see. Okay, now this is the tank that you can see. Requires water so that we get humidified oxygen, the oxygen that will keep our nose and the airway a little bit soft and not dry it out. Okay, so now this can be just pulled out. See here, pulled out. It fits in these sockets here and here. Now this is the water tank. Water has to be only at this level. This water has to be changed every day. This is a distilled water which I have put, so you can get distilled water in any places. And if you don't get distilled water, according to the manual of this machine which is here, okay, according to the manual of this machine, you can even use boiled and cooled water. The water has to remain only till this level. Now how do you put the water in? Here right on top there is a rubber cork. So you just remove that rubber cork, put the water in here. Wait till the water level reaches here, and once the water level reaches there, close it. Once the lid is closed, now see this side there are this button like thing, no? They go exactly in these holes. It's very easy. Just fit it in. Fit. Okay. Now this is done. Now this is the oxygen. This is the oxygen level. That is how much do you require. Now I'll put it on again. Now if I require oxygen which is prescribed by my doctor, because the oxygen is a medicine, it needs to be prescribed by the doctor. You can't just take it because you want to take it. If your oxygen level is falling below 95 always, your doctor is going to advise you to take oxygen maybe with oxygen concentrators. Oxygen concentrators are the portable ones. These are the portable ones, small ones. Okay. Now there is a plus here and minus here. If you turn it towards plus, this ball will go up, and if you turn it towards minus, the ball will go down, and wherever the ball settles, that is the liters, the oxygen in liters per minute that you get. Okay. So that is the amount of oxygen that you are going to get. How to take care of this device? Just clean it every day with a plain sanitizer, that is fine. You have to change this water every day. Right behind this machine, I will just turn it now. Okay. Yes, so now this is the inlet of the water, the air. Why? Because the oxygen concentrator basically takes the regular air from outside and concentrates that oxygen and gives it to us, removes the nitrogen. Okay, this is the outlet from which it is throwing out the nitrogen. Now this doesn't require oxygen cylinder unlike the other machines. It just takes it from air. So to some extent you can manage a patient on oxygen concentrator. The serious patients cannot be managed. The patients at home can be managed on oxygen concentrator, or the patients who are in the hospital and don't require serious treatment. Now this knob that you see behind on the machine, this is the filter which is there. Okay, so this is the goodie of the filter, the cap of the filter, and this is the filter. So this filter can be washed once in 2 to 3 days. See that it is not soiled. If it is soiled, wash it with plain water, and you get some extra filters along with the machine. So fit it in here, put this back, that's it. You don't require much. Okay, so I'll turn it again. Yeah, so this is the machine that is donated by GENO Foundation to Indian Medical Association Goa, the Bardez branch, and it is ready to help you out. If you require, please contact this number. We will be able to help you by giving this machine for a certain period of time that you require. Use it, let your patient be better, then give it back to us in working condition. One more thing that you should remember while returning the machine back to us is that this water tank, remove it, open this rubber cork, throw the water out. So I will just throw it and come back. So now I have thrown this water, you can see. Okay, then close the lid. Preferably keep it ulta like this so that all the water comes out, it dries, and then you can wash it with detergent also. When you use it on a regular basis, wash it with detergent. Then you put your cork back in this, yes, and fit it back in this machine and give the machine back to us intact. Yes, bye-bye. I hope you understood. If not, please ask questions. See you. Bye.